time lost is brain lost. That means 1 second, if there is a blood occlusion happens to the major branch of the artery which supplies the brain, 1 second the blood is not going, 32,000 neurons will die. That means for 1 minute, 2 million neurons is going to die. What I look stroke, the brain loss is equal to the time loss. So time is brain and the brain is time. I also equate the brain is time and the time is brain and the brain loss is money loss. So the patient actually loses so much of brain and the patient will become disabled and they are not able to function properly and they are not productive. Usually this stroke happens very common in India about 1.5 decade, that is 15 years earlier when compared to a Western population. In Western population they get stroke at age of 75. In India we get stroke at 55. So in India 45 to 55 years of age is the most productive. For example, in a house or in a family, you have a 45-year-old man who got a stroke, he has children, they are dependent on the father, and if he gets a stroke, he becomes disabled and the whole family burden and the family will have to suffer the stroke. So that's why the time is very important. Whenever the patient develops this acronym, what I call FAST, fast, you should get the patient as early as possible to the hospital. How early? It is very important. The patient should reach the hospital within 4.5 hours of the onset of symptoms, so that we can give an injection called intravenous injection called tissue plasminogen activator, which actually bursts the clot which is there inside the blood vessel, so the blood will flow into the brain and the area of the brain which is going to die can be salvaged. So it is very important that the patient should reach the hospital as early as possible to a facility which has the treatment and the facility to give the further treatment. Why? Because from last 20 years we are giving this injection, but recently since last 1 or 2 years we are getting a new treatment. If the patient develops stroke, within 6 hours we can do a treatment called mechanical thrombectomy, where we will do an angiogram of the brain. If there is a clot in the blood vessels, we will go through the angiogram. How we do the angiogram to the heart, we do the angiogram to the brain. We will go inside the blood vessel, we remove the clot. So this is recommended in a patient who has a stroke, and the patient should come within 6 hours from the onset of symptoms. That's why brain can be saved if we come to the hospital very early. That's where time is brain. So we should be fast. So be fast and we can save the brain. The most common risk factor for the stroke is hypertension, diabetes, smoking, excessive alcohol intake, hypercholesterolemia, and the most important at present in India is lifestyle, obesity, especially in abdominal obesity. And there are some genetic causes which can contribute to the stroke recurrence, and so homocysteine problem or the hypercoagulable state where the blood will get clotted easily because of the genetic problem. So we know the risk factor of stroke, hypertension. So the patient, if he is having hypertension, you have to control the hypertension. That means the blood pressure should be below 140 by 90 mm of mercury. If the patient is having diabetes, we should control the diabetes. The sugar levels, HbA1c should be less than 7. Hypercholesterolemia, that means cholesterol level high, should be controlled. So this risk factor can be modified. Those are hypertension, diabetes. If somebody is smoking, you should tell them to stop smoking. And if the alcohol, people are taking alcohol, I think you should reduce or even stop it. That is best. And the most important thing is lifestyle modification. What is lifestyle modification? Basic, very common thing which we can do. I'm not recommending you should go to the gym and do it. Simple, brisk walking, 45 minutes a day, at least 5 days in a week will actually keep you both heart and the brain healthy. So these are the way we can actually prevent stroke. And one more important thing is, if you had any symptoms, you should not neglect, so that you can prevent the next big stroke. so that you should go to the hospital very early and take the treatment. There are two types of stroke. One is called ischemic stroke, other one is called hemorrhagic stroke. Ischemic stroke happens if the clot has formed from the heart or from the blood vessels of the neck. The clot from these two areas reaches the blood vessels in the brain. It is something like heart, from the heart the clot is there, or from the neck vessel the clot is there. It goes to the brain and blocks. It is called ischemic stroke. Hemorrhagic stroke is in which the blood vessels will rupture and the bleeding happens outside the blood vessel, which causes the compression of the brain, leading to stroke. So these are the two important types of stroke, and the treatment is for the clot. If it happens inside the blood vessel, we have to give a thrombolytic agent. If it happens outside the blood vessels, we can't give that injection or a treatment, and that should be managed conservatively, or if it is needing surgery, we might have to do surgery, or controlling hypertension will be the treatment of choice.